Hi, Mr. C. Today we're going to take a closer look at your chest and lungs. I'm just going to ask you a few questions. Do you have any difficulty breathing, any chest pains or anything that you would like to report?
No.
No, okay. Do you have a cough or anything?
No.
Any pain?
No pain.
Are you a smoker?
No.
Have you ever smoked before?
No.
Okay, sounds great. Just going to take a quick look. First, I'm just going to observe your trachea. Just lift your neck up for me. Okay, everything looks normal. Everything looks fine. Now I'm going to look at your suprasternal notch. That should be between your clavicle, so you could relax your neck. Okay, so right here, that's in its normal position. And then I'm going to look at your angle of Lewis, which is between your second rib. So this is your first clavicle rib. Here's your second rib. Okay, and that's right here. Feels equal on both sides. I'm looking at your thoracic area. There's no abnormalities. Nothing noted with your skin. I see you have a scar right here. That's from open heart surgery?
Yes.
Okay. No bulging, no depressions, there's no pain you said anywhere?
No.
Shape is regular. Symmetry on both sides. Your AP diameter looks to be 1 to 2 or somewhere approximately in that area. No abnormal coloring, no lesions. Everything's looking good. Okay, I'm just going to take a listen to your lungs, your anterior and your posterior side. Then I'm going to look at your respiratory rate. Okay, I'm going to come in front of you. Just breathe for me. Sounds good. Take a deep breath for me. One more. Okay, breathe regular. Okay. Sounds clear. I'm just going to listen to the back. Take a deep breath. One more deep breath. Okay. Can you lean your neck all the way forward for me? Okay. So, your C7. T1. Everything back here is normal, shape is normal, AP diameter seems to be 1 to 2, just as in the front. Color is normal, no lesions. Can I see your fingers? Can you hold them up for me? No clubbing on your fingers, you can put them down, thank you. No lordosis, kyphosis, or scoliosis present, and no lesions. Are you ever dizzy when you're breathing or no?
No.
Okay. I am going to just watch your respiratory rate. Your rhythm seems to be normal. You have no effort problems. Your lungs are clear. Okay. I'm just going to measure your respiratory rate. No, I just have to watch you breathe. Okay, so your respiratory rate seems to be about 18 breaths per minute, so that's normal. And no effort problems. You said you're not dizzy, you have no shortness of breath?
None.
Okay. There were no rhonchi, no wheezing, there's no cough present, correct?
Correct.
Okay, and no crackles, so all adventitious sounds are not present. Okay, so while we took a break, I had Mr. C march in place for 4 to 5 minutes just so I can look at his respiratory rate of a minute after he has been having some cardiovascular exercise. So I'm just going to check your respiratory rate. Okay. Just breathe regularly. All right. So that's about a half a minute. So after 1 minute, the respiratory rate would be about 25 to 26. So it's increased with exercise activity. I'm just going to listen to a few more breath sounds. Okay, so I'm going to listen to your bronchial sounds. Bronchial sounds, which are by your trachea. Okay, clear. Vesicular sounds. And they continue all the way down here. I already listened to these, they were clear. Then your bronchovascular sounds, which are in here. Okay, no increased breath sounds, no rubs are present, both posterior and anterior. Now I'm going to look for symmetric chest expansion. So I'll put this chair over here. So I'm just going to put my hands under here and note the movement. Okay, just take a deep breath. Okay. So I see symmetric chest expansion. My thumbs are moving symmetrically on both sides, and there's smooth chest expansion. I'm just going to have you say the word 99 a bunch of times so that I can note similar vibrations on both sides of your chest, okay, from one side to the other. So first I'm going to go here, say 99.
99, okay. 99, 99, 99, 99, 99, 99, 99.
Okay, similar vibrations on both sides. Okay, so when listening to your back, I heard low-pitched, clear sounds. I'm going to listen to your chest. Can you repeat the words for me? Can you just say E whenever I touch your back with the stethoscope?
E.
No, just one long E.
Oh, okay.
Okay, E.
E.
Okay, and?
E.
Okay, good.
E.
Okay, good. I hear E, exactly what you're saying. Now, can you whisper the words 1, 2, 3? Whisper so that I can see if I hear you correctly. Okay? All right, one more time. Okay, so what I hear is very, very faint, and that is within normal limits. Okay. And now I'm just going to do something. Okay, the last thing I'm going to do is called excursion, and I'm just going to palpate your back and then put a small piece of tape on your back when the sounds begin to get dull. What I want you to do right now is exhale and then hold it, okay? Okay, you can breathe. Okay, we're going to do the same thing. Exhale and then hold it. Okay, you can breathe. Yeah, you can breathe. Wait, not yet. Okay, now I want you to take a deep breath and then hold that. Okay, one more time. No, take a deep breath. In and out. Okay. So I'm just going to measure. Both sides look equivalent to one another. On your left side, my right side.
My right side.
Yeah, we have about 5 inches, and on
Left side.
your left 4.5, and that is both within normal limits. Thank you very much for letting me examine you, and have a good night.
You're welcome.